wana ezalaki nayaka na vive ezalaka le 15 juillet 2023.
They were tired. You could just see just how heavy everything was on them. She was also extremely pregnant.
Après arrivé nanga na vive tango na komi nazalaka vraiment na douleur ya kobota.
They had already been to the Canadian border and turned back.
Nazalaki vraiment lisusu na makasi te.
We had no space.
Po toyebaki esika tokende te tokomi liboso ya vive mwasi azosenye.
And it was a really complicated, hard experience. We've been full for almost 2 years. It's really rare for us to have beds available.
Vive ezalaki pe ya kotonda me balukelaki biso solution.
This service just doesn't exist anywhere else. There's not enough funding sources. There's not enough grants to do this particular kind of work, and the need is monumental. We need people to help give.
At Jericho Road, we care for the most marginalized, the people in the most need, no matter if they were born here or if they came here yesterday. As we took care of patients in the clinical setting, we found that there are certain things that made our patients sick that needed to be addressed in sort of the social or structural policies or things that happen outside of our clinic. So I'm thinking like the zip codes that our patients live in, sometimes the color of your skin, your access to education, the language that you speak, all of those things drastically affect our patients' health. And so we started building out these programs that would fill the gap. What we found with a lot of our new American clients, especially women who are giving birth, is that they needed to have an advocate in the birthing room, but also someone who could help them navigate the cultural differences between what their experience was like in their home country giving birth and what it will be like here in Buffalo. And so with our Priscilla project, we're really intentional about hiring community health workers and doulas who are not only culturally competent, but often from the same communities as our patients are coming from.
Priscilla project help women who are pregnant and come to our clinic and they don't know how to go, when you are pregnant. First, mom, they don't know how to go to the donation center, how to refer to doctor. So they don't know how to do that and apply the wigs for them because every mom need milk, need nutrition for them before delivery. And somebody, they don't have Medicaid, we transfer to the Jericho Road drop center.
There's been so many studies on maternal mortality, infant mortality, and some of the causes. Basically, a lot of the causes are that women are not being heard. So if I am pregnant and I am a Priscilla Project client, I have somebody that's going to walk alongside me during my pregnancy. So maybe I need a car seat, or maybe I need baby clothes, or maybe I need just help me get an appointment with WIC. Somebody who's going to teach me about the phases of labor and who's going to be there for me when I'm in labor to help me through the whole process. And that person doesn't walk away once the baby's born. That community health worker doula, she comes to my house after the baby comes home. And I feel like every single woman should have a doula, community health worker. I think that they have really met a lot of the needs of our growing families.
At Jericho Road, creating access to quality healthcare is so important to us, and we are doing that both here in Buffalo and also globally. We are in Sierra Leone, in Goma, and in Nepal, trying to bring healthcare to some of the most remote, marginalized places on Earth.
Back in 2015, there was a horrible earthquake in Nepal. One of our staff, Pastor Perna, was from that village in Nepal. And he went back home to help out. And he called back to Dr. Glick and Dr. Paul and said, we need help. What we decided to do was start a mobile clinic. So then they said, well, we kind of need a clinic. We need like a health clinic, not just a mobile clinic. And in the year 2022, in May, We had our grand opening. We hired a staff. 2 years later, when I went back, I could not believe everything that they had available. It was amazing. Before we had our clinic there were no medical services. If you needed medical services, you had to travel 4 to 5 hours down the mountain to Kathmandu. We were seeing patients that have never in their entire lives seen a medical provider. So can you imagine the need? The need is very great.
Another program I'm really excited about is our hypertension program, especially on the east side. We've found that our patients who live in certain zip codes are more likely to have shorter lifespans and are often stressed by some of the systems at play on the east side. And so this program does a lot to address some of those issues.
One of the biggest challenges that I see that we have here is health illiteracy. People don't really have the knowledge and understanding about how illnesses can impact their health. Much of the work that we do is doing hypertension outreach and to make sure that people understand the consequence of hypertension.
My name is Marielys Colon. I'm a community health worker at Jericho Road. We have a list of anyone who has hypertension at Jericho Road, and we call them and let them know that we have a program to help them reach certain goals, and we put certain goals together with them depending on their lifestyle habits that they're currently having and help them achieve those goals.
From my perspective, I can say that people don't have any knowledge about hypertension, and then we see them changing their lifestyle. That means that if they are changing their lifestyle, we are also playing a big role in changing the rates of slowing down hypertension. So it's changing.
Some other work that we're engaged in is the work we're doing around lead. We're seeing that this is disproportionately affecting our patients. We not only have a doctor who's an expert in how to treat lead, how to prevent lead, we're also working on education initiatives within our program side.
So we have them come to our clinic, we schedule an appointment, we do home visiting, we train them, we talk a lot about lead. We try to tell the parents how consequential it is for children if it is not treated on time. And then when it is really elevated, this can also impact children's cognitive capacity. So we tell this to their parents. It's a new project, we're still working on that, but at the start looks so promising.
Vive is a shelter that is designed specifically for asylum seekers. What often will happen is that we'll just have people show up at our door. They have nowhere else to go. They maybe have just recently entered the country. They don't know who else to turn to. So they have a complicated legal process to work through. They don't have anywhere else to stay. Their family is hungry and the trauma is severe. They look for a place to find some safety and they get to our door and we're able to say, do you need something to eat? Can we give you a spot to just rest for a moment? And then we can review their legal case. We can talk about the circumstances of what they're dealing with. And potentially, if we have the space at the time, we might be able to get them a bed. If we can't welcome them in here, we'll help make sure that we can pass them on to another safe location where they can go next. Some of the things that we can offer also within Jericho Road and why we're uniquely poised as a shelter in the wider umbrella of Jericho Road is really exciting, because not only can we do things like mental health supports or physical health supports, but we'll make sure that if a mom is pregnant and she's getting ready to deliver for the first time in the United States, we'll plug her in with Priscilla Project. Or if there's kids that are first time that they're enrolling in school, we're going to get them connected to all the different other services there. While they stay with Vive, for instance, they can also enroll with English as a second language classes or other supports. We want to just find anything else that is supportive within Jericho Road and plug them in. And so it's a fantastic way to have this multidisciplinary, multifaceted support for our families that stay here at the shelter.
If someone wants to get involved with our work at Jericho Road, there are many ways to do so. You can be a volunteer, you can give if you're financially able to. If you have an expertise, maybe you could donate some of your time to help us, whatever it is. That's not just at Jericho Road, that's also with our partners who do similar work.
So I hope that everybody that is here tonight would like to support our Priscilla Project efforts, because every woman deserves to have a doula with her. Every woman deserves to have a voice. We know the value of having a doula with you, and we hope that you will join us in supplying that valuable person to every woman's life.
People can get involved in a variety of different ways. We love volunteers at Vive. We can't really do what we do unless we have people who want to come and join and partner with us and come work for us. We need people to be a part of the Jericho Road family in that sense. One of the other big important ones is to tell the story.
Talking with your community, your family, telling them what you've learned tonight, talking about how poverty affects people. That simple act can go a long way in affecting our patients in our community and caring for them. It can also contribute a lot to the work that Jericho Road is doing and what we hope to do in the future.
Join us.
Join us.
Join us.
Boeni malamu.
Please join us.
Help bridge the gap.
Help bridge.
Help bridge the gap.
Help bridge the gap.
Walk the Jericho Road.
Walk the Jericho Road.
Walk the Jericho Road with us.
Tambola na nzela ya Jericho elongo na biso.